I, along with all of my fellow Alabamians, have been monitoring closely the rapidly changing development of the coronavirus in our state. As a state, we have taken preliminary measures and made preparations in the case that this virus would eventually reach our state. Our first case of confirmed case was announced earlier today. As I've emphasized time and time again, the safety and health of all Alabamians is paramount. A short time ago, we heard from President Trump, who officially declared a national emergency amidst this outbreak. And this declaration will certainly help us states around the country continue to work to mitigate this virus. In Alabama, we want to work in conjunction with these efforts, and to that end, I am now issuing a state of emergency for our state of Alabama. The state of emergency will strengthen our efforts and plans already in place, helping to alleviate our health care facilities and providers, our schools, and in turn, citizens across our state. Additionally, effective Wednesday, March 18th, at the close of business, all public K through 12 schools across the state will have a 2.5-week break. This is in order to reduce the risk for students, teachers, and others from potentially being exposed to the virus. Folks, let's take a common sense approach and remember that calm and steady win the race. Alabamians should not be fearful, but instead use common sense to watch out for ourselves and for others. We will remain engaged and continue to closely monitor the situation to help keep Alabamians informed on all of the facts. The safety and well-being of our citizens is of the utmost importance. Again, I appreciate the hard work of our State Health Officer, Dr. Scott Harris, State Superintendent Dr. Eric Mackey, Alabama EMA Director Brian Hastings, members of my task force, and countless others. We will handle this situation together. Now I'll turn the program over to Dr. Harris.
Thank you very much, Governor Ivey. Thank you. I'm Scott Harris. I'm the State Health Officer. We appreciate you joining us this afternoon. Thank you to Governor Ivey for your leadership on this issue. I've spoken to you a few times from this position over the past few days, and we are grateful that the governor has decided to declare this state of public health emergency. We think that's exactly the right response, and that will help us so much in our ability to carry out our public health functions and make sure that we're protecting the health and safety of all Alabamians. I have some additional information to let you know about that we have just learned about in the past few minutes. We had a second confirmed case of the coronavirus that we were just notified of less than 30 minutes ago. This was from a person residing in Jefferson County. That patient and that patient's physician have already been notified of that. This is a person who has been isolating at home because of illness. The Jefferson County Health Department is involved with that process, as are ADPH staff who will be a part of that investigation as well. I would say that this is a very fast-moving situation. We're not surprised to have additional cases, and we have been expecting this for some time. I would say that also that in the past 5 to 10 minutes, just as we were preparing for this press conference, we have some preliminary reports of 3 additional cases, so that would bring us to a total of 5. I don't have full information on that at this time about those locations, but we'll try to provide that for you as soon as possible. Again, this is something that we have been expecting. We have known that we probably had disease transmission in our state, but as we have ramped up our testing capacity, we are starting to find these cases just like surrounding states have had. We have a number of responses that I've talked to you quite a bit over the past few days. One additional thing I'd like to let Alabamians know about tonight is we have a call center that will be established starting at 8 a.m. Tomorrow to answer questions and help people who are concerned about whether they are need testing to call and get information on how they could obtain that. This is not a medical information call line to talk to a physician or to get a diagnosis, but rather it's a call line that will give you information about how you might be tested depending on where you live and whether you have a doctor. The number for people to call starting tomorrow is 1-888-264-2256. I'll repeat that, 1-888-264-2256. This is a toll-free hotline for people to call if they have questions about whether they need to seek testing. This will put them in touch with their own provider if they have one, or try to connect them to another provider who can help them make a decision about that if they do not have a provider relationship already. Again, that will go live tomorrow morning at 8 a.m. I'm sure there will be many people called because many people are concerned about this, so continue to call. We'll increase capacity on that hotline as needed, and so that way everyone will have the opportunity to call and reach someone and speak to a person about that. That's all the new additional information I have at this time. We'll take questions in a few minutes if you have additional questions, but at this time I'd like to turn the podium over to Dr. Eric Mackey.
Thank you, Dr. Harris, and certainly thank you, Governor, for being proactive. We were very fortunate that the Governor called a task force together several days ago and got way ahead of this before we even had one confirmed case in the state. So we're able to react very quickly as new cases are confirmed. We're also fortunate that she's been very proactive to go ahead and make a decision about what to do with our schools. As the Governor said, we'll be closing school at the end of business on Wednesday. That gives parents 3 days extra to begin working on and thinking about child care. We didn't want to do something that was too quick, because we know that parents need some time to make those decisions for their children. But we will close on Wednesday. We will be closed the 2 weeks following that, and then we will make a decision, working with public health and with the Governor and her task force during that 3rd week about what we need to do going forward. We will not wait until the last minute. Obviously, things are changing very fast, but we want to give, as we make changes then and make decisions about what we have to do after that last week of the closure, we'll make that decision as quickly as we can based on the information that's available that week.